critical survey about the National Unified Medical Record in United Arab Emirates and the concept of interoperability. So the background, what is actually happening here in UAE? Lifestyle diseases are responsible of more than 50% of the death. This is reported by the WHO, which is the World Health Organization. And talking about the UAE itself, it is 90% of the mortality are caused by the chronic lifestyle, including diseases induced by diseases and injury, and 30% of them were due to the cardiovascular diseases. Diabetes is becoming an epidemic, and almost 20% of the UAE population is suffering from it. So the burden of these diseases is causing a huge burden in the government and in the country in terms of the expenses. As $36 billion costs were actually spent, and it's anticipated to increase to 68 billion by the year of 2022. If we are in the same current pace. So what we need to do, we need to think out of the box. We need to do alternative measurement to infuse technology into our current operation to overcome this. So as the direction by the leader, since we realized that we have actually a problem as a nationwide in the healthcare, the leader said by Sheikh Mohammed bin Rashid that the building a high quality healthcare system and providing the best service to the patient requires streamlining effort in this sector. Today we announce a unified national medical record to facilitate the healthcare services and provide up-to-date medical data. When we want healthcare services to reach patients no matter where they are in the country, to realize high quality standards of living to our people and ensure their health requirements are met. So this was announced in the last Feb 2015. So we are working now toward having a solution to our current healthcare problems. So the current situation, it's typical. Let's take to the journey of Zahra. This is Zahra Mohammed. She lives in Sharjah, Dubai, and she goes to multiple private sectors and public hospitals. So she has multiple records in different places, and it's not integrated. So people reside in different cities and visit different hospitals. So I have my mother, she visiting actually in Abu Dhabi and she treated in Ajman. So it's totally different hospitals and totally different network, even in terms of public. There are, in Abu Dhabi it's managed by the local government, and in Ajman it's managed by a federal entity as a healthcare provider. So multiple medical records across different hospitals. No health data sharing. A treating hospital has to contact individual hospital for past records, and loss of time, cost, and quality for patient and physician and healthcare. This is very crucial. How many times you have been like going to this hospital doing X-ray and lab test, and then going to another hospital doing another lab test, just because there is no data sharing. So result in challenges, lack of integrations, lack of efficiency, repetitive orders, loss of financial. This is because repetitive orders are being in place, repetitive radiology order and lab orders, and no unified medical records. So the desired outcome, we would like to have unified medical record. This is the aim, and this is the desired outcome and the direction of the of the leadership of UAE. Is to have provide sharing of medical record among all UAE hospitals and clinics, maintains all important past medical history, and having better clinical decisions among all people, and reducing the cost and time, and better healthcare outcome. So the aim of the survey is to look into previous case studies, to benchmark with other countries who initiated these initiatives, and to study there and to learn about what is the lessons learned they did. So the key concept on how UAE can accomplish this initiative. So it's only a summary to highlight what we can benefit from those case studies that happened before. So the methodology was a systematic search of the published literature review, and some interviews has taken place as well, who are the legal and health information exchange. So the summary result, after I did a couple of interviews with people who working in companies producing this solution to other countries, as well as the leader in UAE and some director in the public sector as well. And we came up that the strategy and the proper planning and governance are the main element to implement such an initiatives. Standardization is very, very important. For us to be able to exchange the data, we need to have standardization. Otherwise, all the information might be mixing up. There are certain and a long list of standardization. If you are looking into the paper, there will be like a huge standardization for the lab, for the radiology, and as an HL7 standardization, only to make the exchanging the data as simple as it can be. And service-oriented architecture model is suggested. This was as an outcome of one of the case studies that happened in Singapore. Singapore probably considered one of the rare cases that actually succeeded and implemented this project. And it actually now covered all the public sector, and now in the phase of integrating the private sector into it. And they actually utilize the SOA. Cybersecurity is very crucial and needs to be considered. And in order to do that, we need to be compliant with what is called HIPAA. HIPAA is compliance with Health Insurance Portability and Accountability Act. And this will help in confidentiality, integrity, and the availability of National Unified Medical Record, and that certain security guidelines are in place. So as strategized, we would like to be, the strategy would be like strategizing, implement, and sustain, where we define all the stakeholders and implement the EHR and evolve into sustainable model. Summary result will be when we have electronic health record cloud implementation for the public, then we move to the private hospital and then to the other clinics and facilities like blood bank. So this initiative is similar a little bit as Singapore as well. And this is only the commercial, and how we can do it is the preparing an RFP. This RFP can be for consultation and strategy. So a consultant company can be involved with the UAE public sector in order to strategize, because when you put a huge project like that, you need to make sure it is actually the feasibility study of it is well defined and it is studied well, and all the challenges is actually captured in order to make sure that we don't get surprises in the road. So this is the governance, and you can see that there are standard groups which will be a representative from all the entities, from the private, the public, as well as the local government. We have a technical group, we have a security group and medical group with the project management group. And there is a hierarchy on that. This is the governance, and governance is very important in such a project. This is just a little bit of a high-level architecture where there is a secure health link, and the register application service can be, we have a portal and mobile app and accountable care, and the facilities license integrated with the partner, and we should look on the licensing and consider some of the legislation to be involved as well. So as a challenge, this is the summary result and the lessons learned we need to be to consider. Participation of health authority and service provider. We need to bring all the stakeholders together and give them some sort of incentives, and as well establish governing committee and contractual relationship. This is very crucial. Stakeholders should be considered in any kind of project. Integrating different HIS systems. Here we need to understand the data set, as well the standardization should be very considered. As I said, HL7 is one of the healthcare standardization to be considered for such a project. Handling privacy and confidentiality, as well as I said, the HIPAA compliance. Change management, we can conduct training and awareness workshop using Emirates ID as a master patient index. We have a different numbers. This is a different medical record number than Abu Dhabi and Dubai. So in order to unify it, we need to get the Emirates ID on board to have it as a master patient index. And selecting an appropriate vendor and product to fulfill the current future expectation. So we need to define the scope and conduct vendor evaluation properly in order to move forward. This was as just a hint, and for the National Unified Medical Record, we actually have another paper will be represented later on with the Sheikh and to go further in details about this project. But this is in a nutshell about my critical survey about the National Unified Medical Record, and specifically I concentrated on Singapore case study in this paper. This is it for me, and if you have any question or discussion, I'd be happy to answer any question of yours.
Any questions?
I just have a comment, not a question. First of all, thank you for a great presentation.
Thank you.
I'm very happy that you've actually put as a major point cybersecurity in the whole project, because it's very critical when it comes to health services.
Thank you.
Is this research done in computer science or project management? Or
Computer science.
computer science?
But for such a project, it's huge, so you can take different disciplines aboard. Project management coming with the computer science. In the paper, there are very technical terms that to be considered as well, but I didn't go through them since the result in a short time.
What are the expected challenges for standardizing that among the United Arab Emirates? I mean, the medical record, it could be structured in different way for each Dubai or Abu Dhabi, and that means is it feasible? Are the government willing actually to enforce standardizing the structure and the shape of the medical form? Because this is very ambitious and great project. Honestly, I would be the first beneficiary from that one, and I'm sure everybody living in UAE actually he suffered from moving between different hospitals, clinics, different procedures, and starting the whole thing again. But everything is go to anywhere using my Emirates ID and have the full data there. Is it doable in your opinion here?
It's a challenging, but it can be done. And your question is very important because you said regarding standardization between all. There
Yes.
are certain standardization that needs to be actually adopted for this project. And there are the HIPAA compliance, and as well as the HL7, as well there are many others like ICD codes, and there is a legislation coming on now to unify the ICD. ICD, what is the term is the classification for the diseases. So all of us, all the private and the public are utilizing should be one classification instead of going to a different classification, because currently some of them are using ICD-10 version, some of them are using ICD-9 version. So this different standardization can be controlled by legislation. So legislation should be coming on board, and there is actually a law for exchanging the data that is coming soon by the UAE government. And once this law is enforced, it will make this a major challenge will be solved now regarding this legislation, because with the legislation regarding the data exchange, especially in healthcare field, it will solve many problems. The legislation, this is under draft now, and it is expected to be in place probably within a year or two, expected with
Have you already approached the authorities? Have you
Yes,
approached
yes,
the authorities
yes,
for that?
yes.
So they are aware about your research and they might be an interest.
Yes,
Okay.
we approach them, and they actually a major stakeholder in the project. So they are from the steering committee. If you saw the governments that I showed you, the steering committee should be having representatives from Dubai, Abu Dhabi, and the public and the private sectors. So they are the major decision makers. So all of them are on board to take a decision regarding the National Unified Medical Records. This is it for me, I think.